The next uveal tumor of importance is the ciliary body tumor. Ciliary body tumors occur in about 12% of all uveal tumors, and the ciliary body, as we know, is located below the iris, and so ciliary body is not normally visible. And patients can be asymptomatic for a long period of time, but the mass, if it is large enough, can become visible when the pupil is dilated. But what is it that we can see very obviously in these patients? The picture here shows you dilated episcleral vessels, which is one of the pathognomic features of a ciliary body melanoma. So this pathognomic dilatation of episcleral vessels is called a episcleral sentinel vessel. And once we see this, we need to investigate the patient for most likely the presence of a ciliary body tumor. So the complications in these patients again can be iridocyclitis, they can be cataract, and there can be glaucoma because of the location of the tumor. And we have to investigate the patient once we suspect a tumor. Brightness scan is done to detect the size of the tumor. Better investigation will be an ultrasound biomicroscopy, which is very useful in patients with a ciliary body tumor. It helps to identify the size of the tumor, the exact location of the tumor, and the presence of any associated fluid. A biopsy is done in patients in whom we cannot reach a diagnosis, and we take a bit of the ciliary body tumorous tissue and send it for histopathological examination. Excision of the tumor is done in patients as a treatment modality. Iridocyclectomy is called. We remove the ciliary body tumor, but of course that has its own complications such as hypotony, which have to be handled and considered before operating on the patient, and also brachytherapy or proton beam irradiation. Basically, radiotherapy is one of the options for a ciliary body tumor. Just to note that ocular tumors are very important because we have just a few tumors that can present in the eye, and almost all of them are not very common, but if they do occur, they can cause catastrophic complications. Hence, it's very important for us to pick up tumors at the earliest stage. Now, choroidal melanoma is one of the very dangerous tumors, and it contributes to 80% of all uveal melanomas. So, most of the times, choroidal melanomas are asymptomatic for a long time, but they can produce a decreased visual acuity and a visual field loss. Another important feature that they can produce is called photophobia. So these patients can be classified, the choroidal melanoma can be classified based on the size and based on the histology. On the size, it can be a small, medium or a large tumor. A small tumor is usually less than 10 millimeters. A medium tumor is 10 to 15 millimeters, and a large tumor is greater than 15 millimeters. And based on the histology, we have another modality of classifying tumors. But clinically, the tumors usually are a brownish elevated mass. As you can see here, it is brownish, it is elevated. The margins are poorly defined. You can't really delineate the margins, and it is a subretinal mass. We call it subretinal because you can see the retinal blood vessels going over the lesion, and you can see that it is slightly elevated, which is causing the vessels to slightly go over it and bend down. And we have this subretinal mushroom description of the tumor, and vitreous hemorrhage is one of the known complications of choroidal tumor, apart from glaucoma, cataract and iridocyclitis. So here in this picture, you can see that the tumor has the feathery margins or the poorly defined margins, but what is probably more insightful to look for is these small areas that you can see, orangish pale yellow pigments. So these are called the lipofuscin pigments. Lipofuscin pigments are characteristic of patients with choroidal melanoma. They are pathognomic of patients with choroidal melanoma.